Uh, I'm going to advance the screen here. This is me. Welcome, Dr. Gerard Pregenzer from Pregenzer Urology, offices in West Hartford and Enfield, Connecticut. Like Lee was kind enough to say, I started practice in 2016, and I was actually I had a very unique initial practice experience. I started with a practice that had a lot of bladder dysfunction, a lot of overactivity. And I got a lot of experience really, really quickly in terms of treating this problem that a lot of people had. And I gained a substantially greater appreciation for how common this is and how unfortunately undertreated it tends to be. And so I'm glad that you folks are here tonight to hear a little bit more about it and what your options are. Okay. Now, many of you might be having these thoughts. You might be feeling concerned, exhausted, overwhelmed, and too embarrassed to talk about it. And I get it. Embarrassment is a real issue of concern for up to 44% of people who have bladder control problems. Too often, it prevents people from getting the help they need. I see this all the time. It's very, very common where I actually have to try to elicit a problem from a patient. So what I personally do, just as an aside, is I have questionnaires. So I don't wait for a patient to tell me they have a problem. I proactively say, is this a problem for you? Because if I don't ask, half the time people won't tell me. So we're here to change this paradigm. A life without limits is possible, and we're here to help you learn how. Now, you need to know you are not alone. Overactive bladder, or OAB, is extremely common. For example, it's more prevalent than vision problems and diabetes, which are two conditions that most of us probably think of as being extremely common, and they are. And OAB, overactive bladder, is even more common. You may be asking, if it's so common, why haven't I heard about it until now? And the reality is that many people with OAB self-manage by drinking less, they wear pads, restrict social activities, and at the same time, many physicians don't realize how embarrassing it is to talk about bladder control issues. So all too often, we don't ask, and you never bring it up, so it stays hidden. And like vision problems, bladder control issues can happen to women and men of any age. And although your risk increases as you get older, that doesn't make it a normal part of aging. It's not something you should accept or ignore or leave untreated, because that can raise serious risks for your and general health. Now, it's really important to note that incontinence is not a normal part of aging or something you just have to live with. It's a serious health issue. I'm sure these descriptions will sound very familiar to many of you. Going more than 8 times a day, getting the have to go now feeling, planning activities around the bathroom, monitoring how much you drink, using pads to control leaks. I had somebody who told me he knew where every bathroom was, between here and his winter place down in Florida along I-95. That's very, very common. Okay. It may prevent you from going places or doing things that you like. You might be fearful of an accident, always looking for that next restroom, making frequent trips to the restroom throughout the day. If that's the case, you need to listen to your body. Now, there are a number of steps involved in finding the best treatment for you. Conservative treatments, as shown on the screen here, advanced therapies on the right. We'll take a look at each one of these things. Remember that every person is unique, and what works for one person might not be right for you. Now, to understand what your body is saying, it's important to know that communication is critical to how the bladder works. Bladder function involves the coordination of the brain and muscles throughout your nerve signals. As your bladder fills with urine, nerves tell your brain that it needs to be emptied. Research suggests that bladder control problems are linked to poor bladder brain communication. Now, keep these points in mind for later when we talk about how various treatments differ from one another. So, where do communication problems come from? Well, there are many potential causes. Some are as simple as what we eat and drink every day or the medicine we take. Some are related to life events like childbirth and health conditions. You may also have injured your pelvic floor, either through an accident or through surgery. In general, there are three common bladder control problems. Now, let's take a closer look at each of them in turn. What is stress incontinence? Stress incontinence relates more to familiar physical activities. It occurs when there is an increased pressure on the bladder as a result of a cough or sneeze or with activities such as lifting, resulting in a sudden loss of urine. Stress incontinence is typically due to weakened or damaged pelvic floor muscles. And this type of incontinence typically requires surgical correction. Urinary retention happens when you can't tell if your bladder is full. This can be incredibly frustrating and may also require you to use a catheter. It may or may not be caused by a physical obstruction, so you may have obstructive or non obstructive retention. OAB, or overactive bladder, is defined by the following symptoms. Urge incontinence is the sudden urge to go to the bathroom, which also results in actual loss of urine. Frequency means frequent trips to the bathroom, as well as a constant urge to urinate that often leads to leaks. If you have OAB, you may have a variety of overlapping symptoms. It's our job to work through these symptoms to help you find a therapy that fits your needs. Right now, we're going to focus on overactive bladder. And the good news is that OAB is a very treatable condition. The first thing to try is often simple lifestyle changes. In other words, these are behaviors that you can use to help your situation. It might mean changing what you eat and drink, decreasing caffeine intake, or getting more exercise. It might involve bladder retraining, such as delaying going to the bathroom or sticking to a schedule. Pelvic floor strengthening is also very important and can be done by repeatedly contracting and relaxing the muscles of the pelvic floor, also known as Kegel exercises. And these are things that you are probably already doing. In some cases, these lifestyle changes may not work very well, or sometimes they don't work at all. When lifestyle changes fail to deliver the results you want, oral medications are the next step. These medications work on the bladder muscles, not the nerves. They can help control symptoms, but they do have some drawbacks. You have to remember to take them every day. The side effects can be unpleasant, and they don't always work, which may be why in one survey, 72% of people said they stopped taking their medication after 6 months. And one last point. For some patients, OAB medication causes some confusion and memory loss. In fact, in a recent large study funded by the National Institute of Aging, published in the Journal of the American Medical Association, showed that elderly people taking anticholinergic medications, which are frequently used for OAB, are at a greater risk for developing dementia. And just as an aside, I really try to avoid prescribing those in my patients as much as I can. If conservative treatments don't work for you, there are more advanced therapies. Medtronic offers two of those therapies, and the third is an injected medication. Let's go over some of the trade offs involved with each of these options. Injected medications treat OAB temporarily and require multiple ongoing office visits. Just like oral medications, injected medication focuses on the bladder muscles, not the nerves. Medicine is injected directly into the bladder muscle to paralyze it, which is why this treatment does not address the bladder-brain communication pathway we talked about earlier. If you use injections, you may be more susceptible to urinary tract infections and end up having to catheterize yourself. These injections are also typically only as effective as oral medications, which may be why so many people quit after just 2 treatments. Here's this next therapy is percutaneous tibial neuromodulation. Here's how this therapy works. It stimulates the tibial nerve, which is located just above and behind your ankle. The goal here is to restore bladder function, achieving a measurable reduction in your OAB symptoms. Each treatment lasts 30 minutes and takes place in one of our offices. You start with 12 weekly sessions and then move on to monthly maintenance sessions. And then sacral neuromodulation, or S&M, or Medtronic's InterStim therapy. This therapy gets the name SNM because it provides relief and restores bladder function by gently stimulating the sacral nerves. Medtronic bladder control therapy delivered by the InterStim system uses gentle nerve stimulation to correct the bladder-brain communication pathway and restore bladder function. A test lets you try the therapy and see if it works before you and your doctor decide to go ahead with it. Unlike some other treatments, our therapy lets you try it first. It's like a test run, not a long-term commitment. At the end of the test, you'll have a much better idea if this therapy is going to deliver the relief you expect. So, what makes someone a good candidate for this therapy? Well, if you have significant symptoms of overactive bladder like urge incontinence and urgency or frequency, or if you have the non obstructive variety of urinary retention, you could be an excellent candidate. Or if you have already tried many different kinds of lifestyle changes and oral medications. And most important, if you're not getting the kind of relief that you want or need to get back to living the life you want. And if this sounds like your experience, the first step is typically an evaluation. This is the proven therapy. 84% satisfaction among those who use it for bladder control, 3 times greater improvement in quality of life compared to medications. 82% of people achieve success out to 5 years after implantation of the device. In fact, sacral neuromodulation is the only therapy that provides better relief than medication. And I'd be happy to answer any questions anybody might have.
Thank you, Dr. Pregenzer. This was so informative and we appreciate your time. Again, we're going to open this up for Q&A now. So if you have any questions, feel free to drop those in the function at the Q&A box at the bottom.